Hello, I'm Andrew Plum. I'm a Senior Lecturer in Medical Imaging at UCL and a Consultant Radiologist at University College Hospital. And I'm going to talk about a project looking at the development of photoacoustic imaging. Now, one of the clinical problems that we have when we're imaging in general, and particularly in cancer, is that the target tissue is often relatively deep inside the body. That's not a problem for most cross-sectional imaging techniques, such as CT and magnetic resonance imaging, but it can be something of a problem for photoacoustic imaging. In fact, we've done some early translational experiments with the photoacoustic scanner in volunteers, and one of the biggest problems that we're finding to date is depth of imaging. We can get images out to about 1 centimetre or so, but beyond that we're really struggling. And this is a big clinical problem because most of the targets that we would really like to image, for example, lymph nodes from metastatic breast cancer, or even some deeper located primary tumours, are just beyond the depth of penetration of the instrument as things stand currently. So it would be extremely helpful and of great clinical value if we had an instrument that could image more deeply, because that would bring a huge range of tissue types into the range of the instrument, thereby solving lots of the clinical problems that we currently have, such as does the patient have disease in a particular organ, or is there spread to a particular target tissue? To address this, we've got an exciting project that will be run in collaboration with myself and with Peter Monroe, and I'll hand over to him now to give a bit more detail about what we're going to be doing.
Hello, I'm Peter Monroe. I'm a research fellow here in the Department of Medical Physics and Biomedical Engineering. One of the keys to imaging ultrasound deep in tissue is to have a highly sensitive way of detecting the ultrasound waves. We're able to do this using this device here, which is called a Fabry-Perot interferometer. This device is very sensitive to the thickness of the 2 mirrors that are used to make it. When these 2 mirrors are brought closer together, the amount of laser light that it reflects and transmits changes significantly. To do imaging, we need to scan a focused beam across the surface of this sensor. One of the problems with that is that when you have a focused beam, the rays within that beam cover a range of different directions. And so those rays actually see a slightly different separation of the mirrors. The mirrors are parallel, but all the rays are not parallel. So, how can we solve this problem? One way is to create novel types of beam where the rays all see the same separation. The other alternative is to use something like spherical mirrors within the interferometer so that all of the rays essentially see the same separation. Now, we can do all this by building experimental systems, and in fact we have done that. But it's time consuming and it is expensive. So an alternative is to build a highly realistic mathematical model based on electromagnetic theory in order to both understand how the current system works better, but also to come up with new designs and test them out. This project will combine physics, mathematics and computation to design the next generation of highly sensitive optical ultrasound sensors. And so UCL really is the ideal place where theory, experiment and clinical translation meet to bring this technology into real-world applications.